On the occasion of World Hypertension Day, we have Dr. Ankeet Dedhia from Mumbai with us to guide us on how we can keep our heart healthy by controlling blood pressure. Welcome, Doctor. Doctor, my first question to you is, what is hypertension and why it's dangerous?
So a very basic and an important question, that is, hypertension is blood pressure elevation, and it is one of the most dangerous condition that we see in our day-to-day practice. Hypertension is the pillar for multiple major coronary, cardiac and cerebrovascular accident or events. So something like a heart attack, a stroke, a paralytic attack, all these are eventually happening because of blood pressure getting elevated or diabetes being uncontrolled. So hypertension is a pillar for all these dangerous illnesses, and that's why managing blood pressure or hypertension is very important.
Doctor, my next question to you is, what are early warning symptoms of hypertension, which if seen, then a person should immediately visit a doctor?
See, many times patients miss these early symptoms, and that's why we come in to help these patients. So hypertension is a very non-specific, it's a under the surface kind of a ailment. So ये blood pressure 160-90 हो गया तो जरूरी नहीं हर patient को headache हो. So every patient may not get a headache or a chest pain or a breathlessness. But yeah, common symptoms would be lightheadedness or heavy-headedness or some giddiness or breathlessness while climbing stairs or sudden palpitations or excessive heartbeat. Patient can feel his own heartbeat or uneasiness in the chest. These are some common symptoms of hypertension. Patient should not ignore these symptoms.
Doctor, my next question to you is, how common is incidences of high BP in India, and what are the common risk factors of hypertension?
The incidence of high blood pressure or hypertension in India is 1 in 3 people. So by 2030, we are going to cross 35% of our population, of Indian population, is going to be hypertensive. And if you see the risk factors, poor physical activity or bad food habits from the crux for blood pressure, along with excessive salt intake, spicy food, excessive cigarette smoking, alcohol, familial or hereditary issues where blood pressure runs in the family. These are all some basic factors which play a big role in getting a patient hypertensive.
Doctor, my next question to you is, what are causes of high blood pressure?
So there are multiple causes for high blood pressure. So sometimes it may be genetic or hereditary if it runs in the family. Sometimes it can be stress oriented. Sometimes it can be diet or food habits going for a toss, like excessive salt or spicy food intake that can lead to hypertension. Also, if you're physically inactive or a very sedentary lifestyle, or if your food intake is obnoxiously junk food kinds, or your physical activity is very minimal and you're obese, then blood pressure can crop up in such patients.
Doctor, my last question to you is, why early detection of high or low blood pressure is so important?
High blood pressure forms the pillar or crux for so many heart or brain related issues or kidney related issues. So catching this high blood pressure patients or getting the blood pressure better controlled by finding out or diagnosing it early in your age is always going to be a blessing in disguise, where you can avoid a certain major ailment like a chronic kidney disease, or a patient who may require a dialysis if the blood pressure is not kept under control, or a patient may develop a heart attack if blood pressure is not kept under control, or a paralytic stroke. So these major ailments, which are life debilitating ailments, will come under control only if you keep your blood pressure under check, and that early detection will definitely help.
Doctor, my first question to you is, what is hypertension and why it's dangerous?
So a very basic and an important question, that is, hypertension is blood pressure elevation, and it is one of the most dangerous condition that we see in our day-to-day practice. Hypertension is the pillar for multiple major coronary, cardiac and cerebrovascular accident or events. So something like a heart attack, a stroke, a paralytic attack, all these are eventually happening because of blood pressure getting elevated or diabetes being uncontrolled. So hypertension is a pillar for all these dangerous illnesses, and that's why managing blood pressure or hypertension is very important.
A public awareness initiative for blood pressure control.